This conference will now be recorded.
Thank you for joining us for Oral Health Kansas's first Friday noon call. These are going to be policy updates just so that we can help you guys get more knowledgeable on what's going on in the Capitol and help answer any questions that you guys might have. In the room, we have Christy Nance. I'm the Policy Director with Oral Health Kansas.
This is Tanya Dorfbruner. I'm the director here at Oral Health Kansas.
And Doug Bowman. I'm the Community Coalition Coordinator here at Oral Health Kansas.
And who do we have on the phone with us?
Krista Hahn with Marion Dental Clinic.
Awesome. So we will go ahead and get started. Get my slide to change. So Oral Health Kansas has a variety of different policy priorities, but all of our policy priorities kind of fit into these three categories of increasing access to providers, increasing financial capacity to pay for dental services, and improving the oral health of the public. You can see our full set of priorities on our website on our advocacy page, but throughout session, these are kind of the areas that we focus on getting more involved in. So legislative sessions started early January, so we are probably 3 weeks in, and so far we have seen a few bills that have been of interest to oral health. So the first would be Senate Bill 11, which is the creation of dental therapists, and I'll get more in detail on the next slide. But we also have some Medicaid expansion bills, and you can see those bill numbers on the slide. It's also Children's Dental Health Month, starting February 1, and we got a proclamation from Governor Kelly expressing that it was Children's Dental Health Month, and that was shared in our WU, our weekly Wednesday update, this Wednesday, so you can see the full proclamation on there. And then we will also be having a Twitter storm on February 13th at 10 a.m., and we had some sample tweets and hashtags that we had sent out as well. And so if you would like to join us for that Twitter storm, that will be next Wednesday. Yes. Also something that we're keeping an eye on are the budget hearings. They are going on right now and will go on through March probably. So next week there is a hearing for the Department of Children and Families. And we're particularly interested in trying to get funding from TANF for toothbrushes and toothpaste, because right now families can't use that money for those, and we just want them to be able to have access to make sure they have healthy teeth. And then also we will be keeping an eye for the KDHE and KDAD's budget hearings that will be coming up, and we'll be trying to talk more about Medicaid adult dental services and reimbursement rates in those hearings. This slide is just an overview of dental therapists. It's something that we've been working on for quite a while in Kansas. A few other states have already passed dental therapists, and so we are trying to get dental therapists in Kansas to kind of help address the gap in the dental workforce that we have, especially in our rural communities and in some of our community settings. So I won't read this slide, but I just wanted to share some of the history of it. So right now, this year there's an initiative led by the Kansas Dental Hygienists Association, and they are trying to pass the same bill that was close to passing last year. And so like I said, that was Senate Bill 11. Last year it was Senate Bill 312, and it made it through the Senate and was killed in the House due to political issues. So they had a dental therapist advocacy day last week, and had about 70, 75 people there at the Capitol advocating for this. So we will keep you guys up to date if we hear of any hearings that will happen, and we'll let you guys know. But as of right now, there's nothing scheduled. This slide goes further into detail on Medicaid expansion. It's a top priority for Governor Kelly, and she has endorsed both of the Medicaid expansion bills that have been introduced. They're very similar to the bills that passed in 2017 and then were vetoed by Governor Brownback. Still haven't heard anything on those, but we will keep you guys up to date on that as well. These are all of the hearings that are of interest to Oral Health Kansas, and so we wanted to share them with all of you. This week, there was a House Health and Human Services hearing that talked about youth use of electronic smoking devices, so e-cigarettes, and Oral Health Kansas submitted testimony on the impact that those have on oral health. It was a very good hearing. They talked about the possibility of raising the age of tobacco from 18 to 21. Not sure if we'll see that this session, but they were very interested in trying to reduce the use of e-cigs among our youth. Next week, there's a similar hearing in the Senate Public Health Committee on Tuesday. Wednesday, in House Rural Revitalization, the Kansas Dental Association and Community Care Network of Kansas will be talking about rural health care issues, so I presume that there will be a oral health aspect to that hearing, and I'm excited to hear what they have to say. On Thursday, Senate Ways and Means Subcommittee on Social Services will be considering the budget for the Department for Children and Families, and Oral Health Kansas will be doing verbal testimony at that hearing. And then that same day, House Social Services budget will have a budget hearing for the same agency, but that will just be an agency presentation. So we presume that maybe the following week there will be opportunity for testimony in that committee as well. And then on Friday will be the CanCare Oversight Committee, and Oral Health Kansas will be there as well to do verbal testimony. It's a new committee, so we'll be introducing them to Oral Health Kansas and our policy priorities. We will remind them of the recommendations made last year in the Oversight Committee, and that was reintroducing the dental therapist bill, looking at increasing reimbursement rates for dentists, and then also looking at comprehensive adult dental benefits. So just reminding them of those recommendations and also the recommendations that we'll be making to the budget committees with TANF and those same priorities. And I wanted to let everyone know that you can listen live to the committee hearings. You can visit that website. Let me see if it'll let me visit it. Oh, good. So once you're on the Kansas Legislature website, you go up to the Audio Video tab, and then you scroll down to State House Live and Archive. And then this will show all of the live hearings. So like here's House and Rural Revitalization, so that's one that we'll be watching next week. And you just click on it, and the audio pops up. Let's see if I can do this. Yeah, so it'll just play. This meeting isn't going, but it'll play right there. And you can also see the archived ones as well on here. So. And then we also wanted to mention some federal policies that we're keeping an eye on. Recently, there was a Medicare bill that was introduced. It's Senate Bill 22, and it would add dental benefits to Medicare. There haven't been any Republican co-sponsors of it, so there hasn't been much movement on it, but we were excited to see this bill introduced. It's something that Oral Health Kansas is passionate about. We've also recently done a lot of federal comments, so the Surgeon General's report on oral health, Medicaid Managed Care Rule, Healthy People 2030, and Public Charge are all federal reports that we have submitted comments on in the last month. And we will keep you guys in the loop if there are other opportunities to submit comments as we move forward. And finally, I wanted to mention the Action for Dental Health Act. This is creating funding for other entities such as nonprofits to have grants to work on oral health throughout the nation. And this is actually a law. It's been passed through both the House and the Senate, and there just isn't an appropriation on it yet. So that is something to be looking for from us, is how to take action on getting some funding in there attached to that bill. Okay, so those are all of the updates that I had from legislative session and also federal, but I wanted to open it up and see if anyone had questions on anything that I talked about today, or other things that maybe you've been hearing that we can kind of help address or answer questions for you.
I do not have any questions. That was very informative, Christy, and I really appreciate the time you've taken to prepare this. And I hope more people hear about this weekly session.
Krista, this is Tanya. Do you have any suggestions about how to, additional information we could be sharing, or how to make this even more useful?
Well, not only was it information sharing, but it was also educational. And so I liked how you incorporated the website too, because sometimes I kind of get lost trying to find like meetings, or someone asked me to go to a budget meeting a couple weeks ago, and I was like, I don't know what I'm doing. I don't know where I'm going. I don't know, you know, so it was helpful to access the website and be able to find the information. So I think that that's good. So keep doing that for sure. I think this might be a good thing to share with our local oral health coalitions, Doug, this opportunity, because I know that probably a couple of people on the Shawnee County group probably would want to join in because they're very intrigued by oral health issues in the state of Kansas. And so I think it would be a good way to connect our coalitions.
I did tell them, but admittedly it was a little bit late. It was very short notice. I didn't hear about it from Chrissy till Wednesday, and I got it to them on Thursday. Yeah. And I only gave them a day's time. So in the future, we'll be sure to give them more lead time. I'm also going to make sure, I'm assuming this is going to be archived on our website.
Yes.
So I think that it's important, I think, to let them know that if you missed it, you can still, you know, watch it. So I think that's important. I agree, though, very much, Krista.
Thank you.
Well, I'm going to go ahead and end the recording.
Very good.